Thank you. Thank you for joining us tonight. We are going to talk about population health. It's a new technology. It is designed to solve a big problem, expensive care in the United States. So thank you for joining us with me. uh, We have Dr. Benbal Valiga. He will be telling us his personal experience of using population health in his practice. He's got a big practice, a lot of patients, diabetic patients. He'll tell you how he managed all those patients, watch them very closely almost every day, and how he handled alert and how happy his patients are. We show first you, Dr. Buliga. Dr. Buliga is basically top-notch endocrinologist. He basically he was trained in India, then in England, and then in New York, and currently now practicing in Opelika as well as in Columbus. And we are lucky to have him in Athens, and he also go to Lacraine. So he is he's using technology to improve care of the patient as well as expand his horizon to multiple area. I know some patients he take care of them from here who lives in India across the ocean. So Dr. Baliga is basically he shows you, he's going to show today how technology has helped him in his practice and how his patients are happy. So, Dr. Baliga, why don't you take it from us and tell us how you do it?
Yes. So, thank you, boss. So great to be here. Excited. Very nice topic. Very relevant topic, right? So, you've seen my practice, right? Um, I have a huge practice. Not because I'm so good, but because there are so many patients. So this is one of the biggest problem we have all over the world, right? The incidence and prevalence of diabetes and obesity is like jumping. Okay, but we don't have enough healthcare providers like me or you to take care of them. And the old way of practicing taking care of the diabetes patients never worked, never going to work. Okay, so we need to do something innovative. So one of the ways we try to keep our patients safe is by putting them in one basket and provide more pointed, meaningful care to these patients so that we can manage them better, keep them safer. And to me, my patients are like my children. We want to keep our children safe. The same thing, we want to keep our patients safe. And how do we keep our patients safe? Okay. So what I see is we have tried everything. I've seen diabetes being practiced in India, in England, now here in the United States. But whatever we have done so far, it's not really getting us to where we need to be, right? And the way moving forward, it has to be the technology. So the technology is going to help us. Okay. In that sense, when you came to me with the remote patient monitoring and your Health Well Safe app, I was interested, because I saw the potential, right? And on the way, you're developing the app, I'm helping you, and we have people like companies like Dexcom
Tell
and
me why you love Dexcom so
oh,
much.
right. Okay. They're a little bit easy to work with Jamel and Paul. They take good care of us. So one of the things what we decided is to integrate all these monitoring systems into our Health Well Safe app, because when I talk to the patient, I need to look at the data. And the best way to look at the diabetes data is by looking at the continuous glucose monitoring systems. And we were happy that Dexcom stepped up to the plate and they were the first one to integrate with our app. And thank you. I just wanted to say thank you to them. That's why we put
People
this slide
from
in.
Dexcom, thank you. And
All
we
right. Okay. Mel and Paul,
yeah.
they were instrumental. So thank you. Can we move forward, Tesco? Sorry, we are having some technological issues. Okay. All right. Okay. So should you go back? Okay. So this is one of the problems. Like, we are a rich country, right? But we spend a lot of money on health, providing healthcare. But if you really look at the pie chart, so who is consuming all the dollars, right? So more than 80% of the healthcare spending is on behalf of people with chronic conditions. So our patients, they're so sick, right? It's not that they have one chronic condition, they have got several chronic conditions. For example, my own patient, they come to me with the diabetes, but they have underlying heart disease, they have underlying hypertension, chronic kidney disease, congestive heart failure, obstructive sleep apnea, you name it. That's why. So when they have one or two or three or more chronic conditions, they need more care, more healthcare dollars. So, and also, if you look at who is driving the healthcare costs, and actually the data is very astonishing, because when you top 1%, they consume about 22% of the total healthcare dollars, averaging about $110,000 per person per year. That was in 2016. And I'm sure it has gone up since then, compared to the bottom 50%. So they consume only about 2.8% of the healthcare expenditure, averaging about $276. So this is another astonishing statistical data. Can you believe we are spending $4.3 trillion on our healthcare?
Even India gross product is not that much.
It's not that much, right? And this is amazing. Just in 2021, it jumped up by about 2.7%, reaching up to $4.3 trillion, averaging about $12,000 per person. So as a share of the nation's gross domestic product, healthcare spending accounted for 18.3%. So is it much more than the military spending? Probably.
We spend less money on safety, military, than the healthcare.
Yes. Yeah. And if you can look at the pie chart, these are all different things that consume all these healthcare dollars. Top of the chart is the hospital care. So that's the reason we have to keep our patients healthier and safer, so that they don't have to go to the ER, or they don't have to go to the hospital for hospitalization, because each visit to the ER means about how much? Nearly $10,000 for the health insurance companies, including Medicare. So the idea is to provide a better care, put these patients in one basket, and do a population health management, use technologies like what you provide, healthcare, Health Wealth Safe. So this is another problem. So I come to your Athens office once a month, right? And we have a nice interaction between you and me, because I have a problem, I call you, you have a problem, you call me. But not everybody is so lucky enough, right? Because the healthcare is so fragmented. You have a patient in the center, you have a family practitioner, internal medicine, endocrinologist, the cardiologist, the nephrologist, eye doctors, food doctors,
and
right?
Nobody talking to each other.
Yes, they try to talk, they send notes, but who has the time to read the notes, right? So something needs to change. So how do we get everybody in the same plate and same way of thinking and share the data, right? That's why what you are doing, where you are giving an access to the patients through your app, so that they can put all their data in one app, they can share it with all the doctors, right? So I like that. So and this is another, you want to talk about this one?
So this, what Dr. Baliga just said, is that we're spending $4.3 trillion in 2021, but almost $1 trillion was wasted because of fragmented care. Just imagine that these data was published initially in 2012 and then revisited again in 2019 and published in JAMA, showing the amount of the medical waste, the dollar which does not improve healthcare, does not contribute anything in patient care, is almost like $1 trillion. So there got to be a solution to this. So payer are asking for solution, and one solution we're going to talk about today is population health. So just think about the waste of the money is almost $935 billion, which is 25% of total healthcare spending.
Amazing.
This is because of fragmented healthcare.
Correct. So if only we can save all this money, right? So yeah, let's talk about what is population health management. So my idea, is, looking at my own patients, why don't we keep all the patients in one basket?
I do that too in my practice. Yes. Every patient who's a hypertension, they are hypertension dashboard, like your diabetic dashboard. Right. And I monitor them every day. If pressure goes up, they protocol driven treatment. Correct. And like the way you do it. Yes.
So if we put these patients in one platform and provide care to the most needy, right? Because not all of them need a daily intervention. Some of them, they need a special intervention. That's why population health management programs, they are very useful to keep a big number of patients safer, and trying to get them to goal with the less amount of money. So use the money, healthcare dollars very wisely, right? Next one, please. So what are the benefits of population health management? One is definitely you improve the quality of the care, at the same time reduce the cost. So that's the best thing, right? You save money, don't waste your money, then provide a quality care. So, and especially provide this care to those patients with chronic and costly conditions. And you can do that by monitoring them very closely on a daily basis. That's why the remote patient monitoring comes in there. Then you can have real-time access and close gaps in care along with the patient-centric view. And hopefully this will lead to better clinical outcome. So. Right. So what are the components of the population health? And if you look at the data or suggestion from a National Committee for Quality Assurance, NCQA, there are different parameters they recommend. The top 6 are: one is the care integration, the second is the care coordination, the third is the teamwork, then the fourth is the patient engagement, fourth is the data analytics and health information technology. See, this is the most important component of the whole thing. And they look at the value-based care measurement. Now, you could imagine a person like me sitting in Columbus or an Opelika, or my wife Pratima sitting in her office in Columbus. You know, we are busy doctors. We don't have time to do all these things.
So let me tell you, Dr. Baliga, Medicare has made its mind that the doctor in the United States has to provide high quality, low cost care. They started, and they are willing to pay for it. They started the chronic care management, and they're paying physician for it. If there are 2 chronic condition or more, they start paying in remote patient monitoring in 2018. They start doing the remote therapeutic monitoring in 2022. And they are paying for telemedicine. So basically, Medicare saying, please use digital health. Take care of chronic diseases.
Right.
And not only that, we'll tell you more about that. Yes. They are watching you.
Yes.
They're watching you. If you're doing a good job, high quality care, low overall cost, and your patient likes you, they give you more money. They give you 9% more money. And in the other side, they can take your money away from you. So Medicare pushing for it. Not only the Medicare now, the commercial insurance also following through that. Correct. That you tell me why you're doing this and why you're wasting money, why this thing is not effective. So this is basically, you know, in old time, the connection between patient and physician was so close. Now it is open. So if you don't provide high quality care, then we're going to knock on the door.
Yes.
If you provide high quality care, they will give you extra money.
Right. It's very important. You know, you saw that news article, right? That there is across the board 9% cut in Medicare reimbursement. So, you know, we are all going to suffer. 9% is a lot of money. So, you know, maybe this is the way to make up for some lost money. You may have to work a little bit harder, but work in a much more meaningful way. Don't waste your time. Provide a good care using all this technology and raise your value.
This is the website, Dr. Baliga. Now, your patient going to go, before they come to see you, they're going to go Medicare Compare Physician. On this side, you can choose hospital, urgent care, X-ray department, or doctors, and compare with other doctors. And Medicare will tell you who is providing high quality, low cost care. Okay. And your patient will, so that Medicare wants you to see that kind of physician, not the physician who's not using digital health.
Right. Yeah, it's very important. You know, nowadays some of the patients come to see me and I ask them, who referred you here? They said, oh, we saw you on the web. So web presence is very important. Yeah. You better have a better scores, right? So again, you know, so who is measuring your value-based care, right? It used to be the insurance companies, but my thing is, if we provide a better care and a model care for everybody else, where the patients are happy, you provide a quality care using all these latest technologies, then you can say, okay, we are a very valuable members of this.
No doubt about it. If you're high quality,
right,
low cost physician, insurance will go on your door. You say,
Right.
Dr. Baliga, why don't you see all our patients?
Correct. Correct. Yes. So these are all different aspects of the population health management, right? You need a clinical integration, you need a population analytics, you need a care management, you need care coordinator, reporting and measuring. So that's very important. The data, you
So
generate data,
in a
right?
in a practice, no single person or even large multi-specialty clinic have this much resources to able to provide everything.
No, no way.
So if you want to do it yourself, it's going to cost you money and
Correct.
resources and knowledge.
Yes.
So my recommendation is we need to partner with somebody.
Correct. That's the reason I partnered with
Yes,
you, right?
yes, yeah.
So you do a great job. So thank you. So that brings us to, how do we, in this era, how do I take care of my patients? I have a huge practice. I have practice in Columbus, Georgia, Opelika, Alabama. Then I have a satellite practice in LaGrange, Georgia. Then I come to Athens once a month. So I have like large number of patients with the diabetes. Forget about other conditions. Now the idea is, what do I do with these patients? Because I see these patients coming to me, and most of them do reasonably well, right? But at the top, about 5 to 10% of the patients, they are in real trouble. They come to you, their A1C is like 14 to 16%, their sugars are in 400 and 500, they are in glucotoxic stage, they have underlying coronary artery disease, and they're sitting on a time bomb, right? And how am I going to take care of all these patients? So this is the model, right? So you put the patient in the center, and you focus on problem patients. You give them more information. You train them on the diet, the exercise, lifestyle modification, and then you want to make sure that they take their medications properly. And you give them enough tools. Some of the tools are available on the web, and sometimes your Health Well Safe app, they can go to different aspects of treatment of diabetes management. This is very useful tool. So the idea is to give enough knowledge to your patients. So as we say, knowledge is power. And once you do that, and you have to sit with the patient, you have to tell them why. They have to understand their disease process. They have to know the implications of non-compliance. They want to know, by controlling the diabetes very well, what's going to be my quality of life, right? Because having diabetes is just like having cancer. Your lifespan comes down.
That's right.
Just having diabetes, your length of living comes down by about 6 to 7 years. And if you have a coronary artery disease on top of that, your lifespan comes down by about 12 to 13%, 13 years. Then if you had a stroke on top of that, your lifespan comes down by about 18 to 19 years. So this is a terrible disease. That's why we help our patients by providing them necessary services. But the most important thing, in my opinion, about is providing them the knowledge, their glycemic control on a daily basis. And how do we do that? We need continuous glucose monitoring systems. We need a remote patient monitoring apps like yours. So that's the only way we can manage our patients. So that's what we are trying to do now. So, right. So with the Health Well Safe monitoring system, what we do, there is a care manager in the center. You have a patient on the right side, doctor on the left-hand side, right?
Correct.
And there is a coordination between all three of us. And the care managers, they contact me. Let's say a patient has blood sugar of low blood sugar, like 40, 50s overnight. So I get a notification, then immediately I can take care of the patient. In the old days, I never got that notification unless the patient went to the ER or hospitalized. By that time, it's a little bit too late, right? So this is where what we do, right? The question is, so what, you tell me why not all the doctors are using this one?
Yeah, that's a question I keep thinking. Tell us about what your colleague is saying. Why they're not doing it?
Yes, they want to do it, but most of them are sort of, they're all busy doctors, well-meaning doctors. They've got so much to do, and they think that, oh, maybe if I do this one, am I going to spend more time? Am I spending, do I need more people to help my patient with these things? That means, am I going to spend more money, right? Because as you say, money is not abundance. It's not in, we don't have a lot of money. At the end of the year, we see our bank account, oh, that's all. left, right. So, and then the fear of the unknown, and people think that, oh, what if there's auditing and all those things. But my recommendation is everybody, all of us endocrinologists, we have to use some kind of remote patient monitoring. And I use yours, which is really, one of the best things I ever did. I can manage my patients better. My patient satisfaction is better. Plus, nowadays, when we use the system, when we talk to the patient through this app, every minute we spend our time with our patient is a billable moment. So there's an additional revenue to the practice. So, um, and this is the desktop app.
I can talk
Yes,
about
you
that.
can
So
talk about
what
this.
happened when Dr. Baliga had like 1,000 diabetic patients, all those 1,000 patients get registered and they go into this dashboard. So all diabetic patients, because of diagnosis, they automatically come into that dashboard, and the patient gets registered, then they get this app. So now patient is connected with this app to the dashboard. So using the dashboard or app on Dr. Baliga's phone, they will show you how they communicate. Give us an example.
Yes. So
So
yeah,
once you get this app, you can keep all your record one place. Data is secure, available all the time. Share when you want it, and update as desired. So basically, it's like a wallet, health wallet. You keep it with yourself. Now almost everybody has a smartphone, but if you don't have it, then you can still join this program using the landline, but that is a little bit more, it takes a little bit more work. So all Dr. Baliga's patients get this. And so basically it's secure. They can sign the consent on this, and you can import the data from other clinic. Next slide. So if you have a health record and you don't want anybody to know anything, you get this health record is so secure, even the health well safe will not see your data unless you give them permission. And then you can program your app that you want to walk every day, and every day if you do the walk, you get rewarded. So you have positive reinforcement, and you can import the data from other sources. Next slide.
Yeah, so this is how I use your Health Well Safe app. So in the center, you have the care manager, right? And on the right-hand side, you see that the patient, of course, this is Sansa from Game of Thrones. Just we wanted to hide some patient details. And on the left, this is the app on my phone. So once I get a notification saying that, oh, this lady has low blood sugars overnight, so I go through the care manager and we do the video talk, okay? We do the telemedicine visit, and I can see in my app or on my desktop the Dexcom readings, right? As you can see on the.
That's why you like Dexcom.
Yes,
Right?
yes.
So
yes,
Dexcom data connected with HealthWell Safe,
correct.
and
That's the only thing that's
yeah.
available to us in the app. As you can see, this patient is having low blood sugars overnight. If you can look at the data from midnight to 6 a.m., there are several hypoglycemic episodes. I don't like hypoglycemia for my patients because hypoglycemia can kill. So that's always high priority. So we call the patient and we find out how much insulin she's taking. Then I realized that she was taking too much overnight insulin. So she was on insulin glargine, 20 units, we cut it down to 15. And she verbalizes understanding. We send a text message so that there is no confusion, right? So once she gets the text message, she says understood, and I get it. Now we know that the patient has been taken care of. Everything is documented, and the care manager, they go ahead and prepare a note, and
So,
that's connected to that.
so tell us how you start your morning.
So I come in the morning, and the first thing I do, and I have Dr. Ali with me. You see, we look at the red triangles.
All those 1,000 patients, you watch them, right?
Yes, in a day I may get two, three.
Three
That's
alert.
it. Not, yeah, that's it. Not more than that. And we take care of it immediately, right? Sometimes we take care of it on the phone, or sometimes we say, okay, this is more complicated than that I thought, and I need to see the patient in person. So we get the patient coming to the office same day, and I will see the patient or my nurse practitioner. We have a Rosa, we have a Kristen, and we have Dr. Tirupati. We all take turns. So the idea is not to neglect this patient, but give them priority, keep them safe, right? can you imagine these patients sleeping at
So
night time?
if you don't take care, then where they're going to end up?
Hospital.
Hospital.
Yes, that means more money, right? Plus suffering for the
So
patient.
the platform give you all the information you need to
Correct.
make decisions,
Yes.
right?
So then, while talking to the patient, I can look at the glycemic excursion. Then I look at the current therapy. Then we can change the therapy, right? So in the same this one, you can click, click, click. You can pick up some medication, new medication, send it to the pharmacy straight away. So then at the end of the visit, we have a beautiful documentation. That's why I like your app, because everything is so well documented. And that becomes part of your EMR.
It is very important to document everything.
Correct.
If you don't document, you cannot bill.
Correct.
So anything you document, so that this system is designed that everything you talk to the patient, the nurse talk to the patient, nurse write anything, everything is counted in the minutes and bill.
Correct.
So all your patients who are in this platform get billed monthly.
Right. So what are the codes that you use?
So basically, there are 4 main codes. One is a monthly CGM. If you have 72 hours or more glucose monitoring, you can bill. And then interpretation of that glucose monitoring, you can bill. And then you can bill monthly RPM devices if they have devices like the glucometer. And then they used to use like 16 days a month to be able to bill that. And then the final report, that whole month report of what happened to patient, how did he take care of it, that you can bill. So basically, if you spend more time, if you spend more than 20 minutes, you can bill another 20 minutes. Another 20 minutes. Yes. So Medicare wants you to take care, spend the time, keep the patient at home, talk to the patient, do the telemedicine with the patient. So treat the patient at home rather than in the emergency room. Correct. And that's, for patients, it's very important because remember, these patients, they are also afraid. They have brittle diabetes. They have uncontrolled diabetes. They've tried everything and they think that they're dying. And in the old days, they could not see me or their private or other endocrinologist for 3-4 months. Can you believe that? Yeah, here yes. In Athens, we have long wait. Yes. So now, and they're very happy. Oh, my doctor called me. Yeah, doctor called. That never happens, right? Never happens. That's awesome. Yes. So whatever we do in our platform can be exported to your EMR or somebody else's EMR at the request of the patient using a CCDA format, and we can even import the blue button from the Medicare. So again, does it work? That's the thing. We talked, right? So that's why I was so happy to see some of the articles which we saw, because these interventions really help. Okay, it saves money for the Medicare. It helps in getting the patients to goal. It brings down the hemoglobin A1C. So this is not just a talk. It's basically, there are like a couple of meta-analysis. Okay, I was surprised when I looked at this meta-analysis. About 20 studies using. This is published last year in ADA. American Diabetic Association. Yes. 22. So A1C came down on an average of 0.42%, which is not a mean achievement. So even not only for diabetes. What about your patients? Well, blood pressure. I mean, this study published in BMJ last 2 years ago, showing that monitoring blood pressure at home and protocol-driven treatment significantly reduce the blood pressure as well as save significant amount of money. Almost each millimeter of blood pressure lowering saved about $15 per patient per study. So not only that, American Heart Association. Look at that. Say cardiologists go for remote patient monitoring for better cardiovascular disease outcome. And I'm convinced that this is the way, the natural way of treating chronic disease. What about the patient? Look at the patient. Patient loves it. Right. This is the study showing that 79, almost 80% of patients who gone through this remote patient monitoring, digital health, they just love it. They go for again and again. Yeah, there's something about these handheld phones. Everybody is watching the phones all the time. And they might as well use it to improve their health. It's a better way. Yes. Better way. Yes. So let me tell you what we do. We believe that and we invite all physicians think about population health. Like you have my in my practice, I may have about 300 patients with congestive heart failure. So they go into database, they have a platform. These patients are watched using weight. Anybody who gain 3 pounds get alert, and so I can take care of them. Right? Rather than they go to hospital, I can take them before that. So we basically you should partner with any digital healthcare company and see how it can improve and bring you to a high quality, low cost physician. It will eliminate duplicate testing, care coordination will improve. You will able to help coordination care for your loved ones. If you are suppose you want your parents are in Seattle, you are in Atlanta, you could be part of the care team and you would know what your dad or mom doing and able to communicate with the physicians,
Perfect.
And you will be better coverage for your insurance company going to love you because the data will start coming out that you are high quality, low cost physician, everything documented, and digital health will keep you connected with your healthcare team all the time. This never happened before.
So my recommendation is for almost all the endocrinologists and even the family practice internal medicine doctors, they can partner with you. And I've seen you don't bind anybody with the tight contracts. So you use it. If you don't like it, you can walk off without anything. So
you should.
I like that.
Your patient spend less time in your waiting room, in the hospital, in the emergency room. So digital health is the way to go. And if anybody has any questions, please put on a chat. We'll take a few questions here, and I'll ask you some more questions for people to. So now, first thing is, tell me why you like Dexcom so much.
Of course, I like all the continuous glucose monitoring system. That the Dexcom is probably they are a little bit easier to work with, and for this particular Health Wealth Save, I like them more because they stepped up to the plate and helped us to integrate the data. So when I talk to my patients, if they are on Dexcom, it's easy for me in one app. I can look at everything. So it's a beautiful technology, and they have a newer versions coming into the market pretty soon. So I just got approved at Dexcom 7. Beautiful, beautiful technology. My patients love it. Okay. Of course, we use Libre, Freestyle Libre. They have Libre 3, very tiny one. And we have Eversense implantable glucose sensor. As you know, I was the first in the country to do
that. Right? Everybody know about that. Eversense is a glucose sensor put in the arm and can last for 6 months. So two sensor per year.
Right.
And then you can get the data straight to the Health Wealth Save, and Dr. Buliga can take care of you even if you go to Europe or India from here.
Yeah,
right?
That's the thing. The whole idea is to use all these good technologies. Okay, look at each individual technology. They're good. Okay. Now, sometimes it becomes difficult to say which is better because all of them are pretty good. There are some differences. Then it depends upon patient acceptance and the cost, whether insurance is covering or not. And I tell my patients, this is what I recommend, accept it, use it. And once they use it, they realize the value of that intervention. In the old days, people did the finger sticks here and there. And what are we going to do with that data? We couldn't do much. So, and patients also get frustrated. Oh, I went to Dr. Baliga, I was testing 2-3 times a day. I showed him, he glanced at it, that's it. Even now, I just glance it because I look at their AGP report. And in one page, I know exactly what's happening with my patient. That's why the AGP report from Dexcom and the Libres and the Eversense, they're like of tremendous value. So that's why I like these technologies. And I'm glad that more and more insurance companies are opening the door. In the old days, it was difficult to get any kind of a continuous glucose monitoring system getting approved.
Right? So you were telling me you were seeing 15 to 20 new patients every day. Is that possible? It's possible for a busy endocrinologist?
Yes, nowadays I can do it because a lot of my patients are on remote patient monitoring. So that frees me some time. So otherwise, in the old days, I had to see my patients every 3 months. Now, patients who are doing reasonably well, I put them on remote patient monitoring. I can see them every 4 to 6 months. That extra time slot, I look at my patients because every day we get about 20, 25 new patient requests. because there's so much of bad diabetes out there.
That's that.
So
And
unfortunately, not many
so,
endocrinologists like me.
so
that's
how
why.
we can solve this problem, endocrinology problem? There are not enough endocrinologists all over.
Yes, so that's why the idea is to give enough tool to existing endocrinologists. Okay, give them all these tools, remote patient monitoring, population health management, so that they can see large number of patients in a safe way. At the same time, focus on like new patients in their practices and really problematic patients, they can be brought into the office. The rest all can be managed remotely in a very safe way.
Chesko, do we have any chat? Any question? So let me tell you what we're going to do next. Webinar will be February 2nd, same time. And we want to talk advance in treat management of obesity in diabetes. The new medication has come up, which are very effective. And Dr. Baliga will educate us about that. So join us next month, February 2nd at 6 o'clock. And in the chat, there is a link. You can click that link and you can register. And we will also send you, if you were registered during this webinar, we will send you a link too. So thank you all. Thank you, Dr. Baliga.
Thank you very much.
Appreciate that for a great,
thank you for all
great
your
talk.
help. And thank you for organizing everything. And Chesko and Judah, everybody did a great job. Santosh, thank you.
The question is what the proper food they can eat?
Yes. So for diabetes patients, what we recommend is a low carb diet. Okay. So Mediterranean diet is a heart healthy diet. So I prefer that. Okay. So the whole idea is to keep the calories less than 1200 a day. Then when you put up your plate, fill it up with the veggies, right? And the meat, fish, chicken, turkey, then very little of rice, pasta, bread, and potatoes. Because most of the time, when you become a diabetic, your body cannot handle sugars and carbohydrates. Especially, we are all guilty of eating too much of potatoes, bread, right? Tastes so good. So the idea is to eat smaller amount of carbohydrates, keep the total calories less than 1200, and avoid any kind of sugary drinks. Okay, no fruit juices, no sodas, no diet drinks, no sweet tea, and just water. Okay, then exercise. Spend all those extra calories that you eat that particular day.
So, Dr. Baliga, you said if you have diabetes, you will lose 6 years of your lifespan, and you have stroke and then you can lose up to 20 years.
Right.
So, but if they come to you and you take care of diabetes, can they make it to 100?
Nobody wants to live to 200, right? But at least, what I'm trying to do is keep our patients happy so that they don't have to die young, right?
Yeah.
And it's a tragedy when somebody dies in their 40s and 50s and 60s because the children are still young, right? And sometimes they may be the sole breadwinner for the family. So there are real social implications of dying young. So, and the other thing is we feel bad because it's totally preventable cause of death. People die of cancer, people die of accidents. That's sort of we accept it as fate. But when you have a diabetes and you die young, then we're like, wow, why didn't we help this person to live longer? It's easy. Just change your lifestyle lifestyle. Eat healthier, eat smaller portions, avoid sugars, exercise, and take your medications and go to the doctors. Don't sit at home until the last minute. Just last week, I saw a new patient who came with a blood sugar of 500 and the A1C of about like 14%. And well-meaning fellow, but didn't know what to do. So I put him on all the right medication. Then I took him to the lab for the lab draw. And there he developed very severe chest pain. And then we had to call 911 and send him to the ER. And turns out about 4 weeks ago, he was in his son's house for Thanksgiving, and he had the same burning sensation. So it was an unstable angina. So this is like a heartbreaking because people, they can die suddenly. But at the same time, nowadays we have all these interventions. We can control your diabetes very well. We can put you on medication that will protect your heart. For example, the Ozempics and the Trulicities and the Jardians and the Farxigas, they all help you to live longer, right? So all you have to do is go to the doctors and sit with the doctor, come up with a plan.
The right doctor, right?
Yes. All doctors are pretty good, but Patients need to be their own advocates. But whatever the doctors tell you, you follow that advice. If you're not happy, always ask for a second opinion. Nothing wrong with that. But yes, you can say what happened now. Diabetes is controlling you. Now I want you guys to control the diabetes.
Yes, you control them. With that, we take off. Thank you, Dr. Baliga, and thank you, Chesko. Thank you, Judah. Are you here on the call? Judah, thank you very much, and thank you, Santosh. We'll see you next week on 2nd February, 6 o'clock, same time. Thank you.
Thank you for joining our webinar. Be sure to follow us at Health Wealth Safe on all social media platforms so you can stay up to date with new healthcare technology. If you have any questions, please email us at info.healthwealthsafe.com. And remember, your health is your greatest wealth, and we want to help you keep it safe.